Good morning, folks. Thank you very much for joining us for our press briefing on the state's response to the pandemic. Apologize for starting a few minutes late today. We're also going to make this an abbreviated briefing. So all the things I normally say with regard to avoid the 3 C's and, washing your hands, wearing a mask, keeping your distance, all that sort of stuff, we want you to do that. Monoclonal antibody treatment, all that sort of thing. I want you to remember all that. But we're going to just jump in today with regard to our update. We've got the incident commander for the Department of Health and Human Services, Angie Ling, who is here today to update us on the vaccines, and then also the Deputy Director of Epidemiology for the Department of Health and Human Services in Public Health, Felicia Quintana-Zinn, is going to be able to talk a little bit more about our plans with regard to Phase 1B as well. So with that, Angie, I'm going to go ahead and turn it over to you.
Thank you, Governor. Good morning. I just have a few vaccine operational updates today. Our allocations for next week did increase. This is due to 2 factors. Starting next week, we'll be counting the extra doses in the Pfizer vial. So instead of counting each vial as 5 doses, each vial will now count as 6 doses. Our allocation for next week will be Pfizer 18,720 primary doses and 18,400 Moderna primary doses. We will also be adjusting our second dose ordering schedule, which instead of having them arrive 7 to 10 days before we can actually use them, we're getting them closer so they're in the window, arriving in the window of when we can use them. As you may have heard, the majority of the vaccine has not arrived in the state as of today due to issues at the distribution sites and weather. We do not have an anticipated delivery at this time. 2 of our larger shipments of Pfizer did arrive on Monday and will be used in our scheduled clinics. They anticipate a significant backlog of orders for distribution once operations resume, and every effort will be made to catch up as soon as possible while safely delivering the vaccines. We will keep Nebraskans informed as we know more information as well. Please be patient as our jurisdictions adjust their schedules based on vaccine availability. And this is a nationwide problem, not just for Nebraska, and we're working closely with our federal partners. And that is all I have for today. Thank you, sir.
And Angie, just a couple things. Maybe kind of contrast how much we expect to get next week versus where we've been in the past. Just remind people on that.
Sure. So this week, what would have been arriving this week was Pfizer 11,700 doses. And with the new calculation, it would be 14,040 doses if we added that 6th dose, and Pfizer 17,000. So we did have a nice bump up for next week, so a couple thousand doses. And also, the retail pharmacy program has not received any doses as of yet this week. So we're waiting to see what that looks like in the coming days.
Great.
Okay. Thanks, sir.
Thank you very much, Angie. So that's good news that we're getting more vaccine, and obviously we want to make sure we get that out as quickly as possible. So Felicia, can you come up and talk to us a little bit more about Phase 1B? I talked a little about this yesterday, about our priorities and so forth, but maybe you could give us a little bit more insight on that.
Thank you, Governor. All right. So good morning, everybody. So Nebraska is updating our vaccine phasing guidance to provide further information and expectations of when the general population will be eligible to receive COVID-19 vaccine. So as health departments are continuing to work through Phase 1B, completing those over 65 years old and critical infrastructure, not including the comorbidities category, Nebraska is finalizing plans to vaccinate in the general population. So with the increasing amount of vaccine supply, Nebraska is expecting to be able to move to the general population in April or May. Preliminary Nebraska residents mortality data shows that COVID-19 caused or was a main contributing factor in 1,801 deaths, with approximately 97% of those deaths occurring in those over 50 years of age. So this represents a significant burden for our older population. So on the graph that we have here, you can see that for those under 50, we have very small numbers in those that have died. But those above 50, it is really a significant burden on that population. So therefore, to continue to ensure that our population is protected, when Nebraska begins vaccinating the general population, Those 50 to 64 years old will be prioritized, following by the remainder of the population, those 16 to 49 years old. So 16 plus for those receiving Pfizer and 18 plus for those with Moderna. The state this week also launched our official COVID-19 vaccination campaign, Finish Strong Nebraska. And for more information and to register on our vaccine portal, you can visit finishstrong.ne.gov. So in summary, preliminary Nebraska residents' mortality data was assessed to make this determination, and those above 50 years of age account for the majority of the coronavirus-related Nebraskan deaths. And the vaccine plan I outlined is for the general population after Phase 1B efforts are complete. Thank you.
All right. Thank you very much, Felicia. I appreciate that. Again, I just wanted to emphasize again what I said yesterday, what we've been actually said last week as well, and what Felicia's just there, is that the single biggest factor in whether or not somebody's going to be severely impacted or potentially even die from getting coronavirus is age. And that's why we've been focusing so much on that 65 years and older category. That's why I've directed all the health directors to focus 90% of their efforts, at least 90% of the efforts, on that 65 years and older category in Phase 1A. And that's why, again, Felicia was talking about, again, as we look out into the general population, we're going to continue to be prioritizing age. Also just hit upon some of the things we also hit upon. Current hospitalizations are at 188. We are 34% hospital capacity, 37% ICU capacity, and 79% ventilator capacity. And we've delivered 677,000 tests through testnebraska.com. And then tomorrow, we will be having a press conference here tomorrow at 10 a.m. Central Time here in the hearing room again. So with that, Taylor, do we have any questions that were submitted ahead of time? I didn't.
Just a few that got texted in.
Yeah.
Mark Balmer from KSNB wants to know, is it fair to blame renewable energy for blackouts caused by what he is saying is a once-in-a-lifetime cold weather event?
I'm sorry, can you repeat that again, please, Taylor? Mark Balmer, KSNB.
He wants to know, is it fair to blame renewable energy for blackouts that are caused by what he is calling a once-in-a-lifetime cold weather?
Is it fair to blame who?
Renewable energy.
Renewable energy on what he's calling a once-in-a-lifetime weather event. And the answer is, it's not just about renewable energy, right? Certainly wind energy has contributed to the blackouts that we're experiencing, but it's also natural gas too, right? And that's because the pipes were freezing up and we weren't able to get a supply of natural gas. And this is not something that actually impacted Nebraska specifically, because Nebraska has been generating more power than we've been consuming in our state and actually been contributing into the grid. So this is about just broadly what the energy mix is. We have to look at sources of energy where you can store energy on site, like coal and nuclear. And when you've got sources where you can't store that energy, like wind and natural gas, you can't have them be such a big percent of your overall energy mix that you're subject to this kind of outage. This outage is unacceptable. And this is something that we have to make sure that we are planning for. It has gotten cold in our state in the past. So while I don't know the history on the other states and their cold snaps, we get this kind of cold weather here in Nebraska, and to have our rolling blackout is because of cold weather is just unacceptable.
Jared with 1011 says, according to the CDC, Nebraska ranks 45th in the U.S. in percent of doses used that the state has been given. What is the plan to get more vaccines out to people? And is this because less people than expected in the current phases aren't getting the vaccine?
So Jared from 1011 saying that as far as doses administered, we're sitting about 45 right now, and yesterday I talked about how we were about 20 with regard to second doses, getting second doses administered, which is really what we're focusing on. That second dose is the important thing because that's when you get full immunity. So that's the number we're focused on, to be able to get out as quickly as possible. However, we do want to make sure that we're getting that. 20 still is not acceptable. We want to move that up in the ranking as well. And so we do have the team that is working on a plan to be able to make sure we're getting those vaccines in people's arms as quickly as possible. So we are working with our local health directors on how we make that happen. So we're working on it to be able to get that out faster. We agree we got to do better.
Brennan Chanley says, have you as the governor deal with the effects of this extreme weather?
So, I'm sorry, who was that?
Brent with Channel 8.
Brent with Channel 8 is asking if we sent aid to Texas with regard to their issues with regard to weather. And no, the state of Nebraska has not sent anything to Texas. We've not been requested to send anything to Texas. We are part of the Southwest Power Pool, so we have been contributing energy in overall, which will impact the northern panhandle of Texas because they're part of the Southwest Power Pool. But most of the state of Texas, I believe, is their own power grid, separate, and they're certainly not a part of the Southwest Power Pools, and we've not requested to provide them any aid.
And then finally, Jeff at the World Herald says, can you explain the plan still ahead for the rest of 1B? What remains of the different 1B groups and when can they expect to get vaccinated?
So Jeff, Robert, the Omaha World Herald is asking about 1B and the other groups in there, and I outlined yesterday that, again, all the health directors have been instructed to focus on at least 90% of their vaccines going to people who are 65 years and older, because as Felicia was explaining, these are the folks who are at the greatest risk. So we're focusing on that, and then it goes to first responders and law enforcement, then down to utilities. And again, this cold weather really demonstrates why critical infrastructure workers and utilities are important to be able to make sure they can be on the job. Then it goes to the folks who are in our homeless shelters, because again, if we have our utilities go out and people are at risk that way, or if our homeless shelters aren't open and those folks don't have any place to go, especially in this bitter cold weather, that's a public safety risk. And then corrections. So though that will be, the rate of that though, Jeff, will be different in each health district depending on a variety of factors, right? Depending on, you know, how did you come out of phase 1A? So we know Lincoln, Lancaster, and Douglas County both were slower to get out of phase 1A just because of the number of healthcare workers and so forth that they had. So other parts of the state are going to be faster to getting to their 65-year-old folks and also to the folks who are in those other categories. So I don't have a timetable I can get you with regard to that, other than we want to work as quickly as possible to get through phase 1B and, you know, waterfall that into. And I know that, there, for example, there are health districts, for example, that are already working with teachers. I believe Dr. Poor is already working on a plan to, as she gets through the rest of phase 1B, to start working on teachers. So those will be also part of phase 1B, and we'll be getting to them as quickly as possible. Is that it?
I have one more question.
Go ahead.
From Ansley at KETV. She says,
Ansley at KETV is asking.
Nebraska state law required OPPD to have at least 15% on top of peak production in baseload power at all times. Has this changed?
So Nebraska state law requires OPPD to have at least 15% on top of their baseload requirements at all times. And has this changed? And I am not familiar with that statute, Ansley, so I can't talk to it specifically. But again, when I talked to Tim Burke, they were generating above their normal load capacity throughout this weather emergency and had been contributing into the Southwest Power Pool. So that's my understanding. I'd certainly refer you back to OPPD, but my understanding is that OPPD was able to generate sufficient power even without, for example, being able to allow to rely on the wind resources. I know that they were converting some of their natural gas generators over to fuel oil to be able to generate electricity that way. So they were taking steps to be able to generate the power. Great, thanks. All right, Andrew.
Can you, apparently we're hearing that there was some disruption in some online services statewide. What do you know about that? What do you say about that?
So Andrew is asking about some disruption to state services, state online services. Today, we did have a fiber outage that impacted our data centers, and that fiber outage, my understanding, has been restored, and so those systems are coming back up. So it was something that did impact our services earlier this morning. I believe that those services are coming back online for the state.
I had a clarification for Angie.
Yeah, Angie, you want to come up? Andrew's got a clarification to ask you.
And the question is it just a recalculation of how they're calculating the doses, or did we actually get an increase in allowance?
Oh, I can answer that question. So the question was, is it just a recalculation? So Angie mentioned that we are now going to be counting those Pfizer doses as 6 vaccines per vial versus the 5 that we had been originally doing it. So part of the change and part of the reason for the increase is that we are going to be counting more vaccines per vial, going up to 6. But that's not the only reason that we are getting more vaccines. We are also getting additional allotments of Pfizer as well, so it's both. We're going to be both counting 6 vaccines per vial, and we're getting more vials.
The other question is, do we know when these shipments that we're supposed to get this week will be coming in?
And the question is, do we know that the shipments that are late, do we know when they're coming in? And I don't believe we have that information at this time. Is that right, Angie? We do not know when they're going to be coming in. And again, as Angie mentioned, there's going to be a backlog of this. So, and this is, again, weather-related events, not in Nebraska specifically. This is about weather-related events that's impacting the entire nation. So we are just one of the states being impacted, and that means that there's going to be a backlog of these getting out all across the nation.
And where are you as far as, I guess, backfilling the volunteers with paid workers?
So the question from Andrew is, where are we with regard to backfilling volunteers with paid workers? And Angie, maybe I'll have you come up and talk a little bit about that.
So we've been working with FEMA and NEMA on ensuring the funds are secured. The way it works is that they obligate dollars to us, and then we pay the bill and then get reimbursed. So we're working through to make sure all the funding streams are solid, and then I've already got information from all my local health departments on their areas that they would need to reimburse. So we're starting to work on those details now. So hopefully we should have a solid plan in the next 7 to 10 days on how we can get those reimbursed and what those costs really will be.
And can you talk about why you're moving up the vaccination for the general population? You know, that seems optimistic.
Sure. So the question was why are we moving up the vaccination for general population? From what we're hearing from our federal partners is that with the increase, we're expecting an increase in Pfizer and Moderna production, and we're also anticipating Johnson & Johnson to come out with an EUA. And if all of those things happen as planned, then April timeframe will be a really big increase in our vaccines. Any other questions? Okay, great.
Another question from Jeff Robb.
Actually, before we get to Jeff Robb, I just want to piggyback a little bit on Angie's response there for Andrew. So, for example, one of the things, I was talking with the Pfizer CEO a couple weeks ago, Dr. Borler, and he originally had committed to delivering 100 million vaccines by the end of March, and Pfizer has now upped that to 120 million. So, again, that's an example of how increased production is going to allow us to be able to make sure that we're getting out vaccines, more timely. And I don't know that we're actually moving up the schedule so much there, Andrew, because originally, you might remember the time frame we had published was end of April, early May. We had talked about getting to the general population. All right, sorry. Jeff Robb, World Herald.
Where do people with medical conditions fit in going forward in the schedule, and how will the state work through those?
So where do people with medical conditions fit into the schedule, and how will the state work through those? And I'd say stay tuned. We'll get you more information on that. Again, right now, we are focused on people who are 65 years and older in Phase 1B, and that is because they're at the greatest risk, even considering the other comorbidities. Folks, it's the age is the single biggest factor here, and that's why we're focused on that. Yeah.
Just to clarify, too, you said when we get to general pop, it'll be 50 and older, correct?
So again, when Felicia was talking earlier, what you really want to set the expectation is, as we even move into general population, age being the single biggest factor with regard to your health risk, we're going to continue to focus on age.
Time for just 1 or 2 more questions.
All right, 1 or 2 more questions. And actually, I think this chart here really demonstrates what we're talking about with regard to age being the single greatest factor with regard to what risk you're at.
No additional news on the death that occurred from the person with the vaccine.
Dr. Anton, you want to come up and talk a little bit about, do we have any new information to provide with regard to the person who died with regard to the vaccine?
So Felicia and I are in contact with the CDC reviewer who's investigating that death. And so far, we haven't had an official report yet, but preliminary is that it does not appear that they think it's related to the vaccine.
Can you expand on that at all? I mean, without going into too much,
No, just so we already know that the death actually occurred 10 to 14 days after the vaccination, and that would be a real odd event to have a death after that amount of time.
All right, time for one more question. All right, seeing none, again, we'll be back here 10 a.m. Central Time tomorrow for another press briefing. Thank you all very much. Again, please remember to avoid the 3 C's. Ask your doctor about the monoclonal antibody treatment. If you are 65 years and older and are diagnosed with coronavirus, you got to get it sooner rather than later. And then please continue to practice all the tools that we have with regard to keeping that 6 foot of distance, washing your hands often, wearing a mask when you go to the store, and of course, above all else, please make sure if you have that cough, that fever, you've lost your sense of taste and smell, please stay home so you don't spread the virus. We're down to about 188 hospitalizations right now, which is about 4.5% of our hospital beds. That's really good news. We would like to see that number go down further. We need your help. Please continue to practice all the tools we've given you. Thanks a lot, and we'll see you tomorrow.